Dr. Brent Wallis, the Chief Medical Officer of People's Health, talking about senior health, whether you happen to be a senior or maybe you're the son or daughter of a senior and you want to help your parents out. Hey, Dr. B, how you?
I'm good, Tommy. How about you?
I'm very well, sir. Thank you. Betsy the boxer is just a wonderful dog, and how's your boxer? Good?
Yeah, Jack's doing great. He's looking forward to Father's Day in a couple of days.
Oh, is he? Okay. So if you're approaching 65 and you're overwhelmed with your Medicare options, you are not alone, or your parents. Even if you're on Medicare now, you still might have some questions about how it works, because Medicare can be complicated to understand. Dr. B is going to help us from People's Health here to dispel some common myths. Before we get started, Doctor, I had to go get a medical procedure done, and there were some older people there, and, man, they were having these conversations about Medicare, and my head was spinning, because I don't even know what it is.
Yeah, it can get very confusing.
What is Medicare?
Well, Medicare is it's a health insurance program, but it's one that's funded by the federal government, and it provides benefits to anyone who's over 65 and even some of those under 65 who have disabilities.
So how does People's Health and Medicare, how do you all interface with that? What is the connection there?
So People's Health has a contract with Medicare, with the government, to offer something called a Medicare Advantage plan. And Medicare Advantage plans, like People's Health, they actually administer those benefits that you get under a program that actually sometimes can provide even enhanced benefits. And those Medicare Advantage plans are rated on a star system out of 5 stars. So People's Health has multiple plans that are all rated 4 out of 5 stars for the last 3 years running.
So original Medicare is just what the government you pay for from the government or something, and then People's Health supplements that? Is that what's going on?
Yeah, essentially the benefits pass down to People's Health, and they can create additional supplemental benefits. They administer everything, and they pay the physicians as well directly, rather than the physicians having to get paid directly by the government.
So that you handle it all. It's like one-stop shopping almost.
Exactly.
Okay. Gotcha. All right, here we go, audience. We're going to play True False, and I would ask you to lock in your answers in your mind, and there's no changing. So here we go. True or false? Medicare is only for people 65 and older. Audience, lock in your answer. Is that true or false? Dr. B?
That's false. And actually, a lot of people have that misconception that you have to be 65 or older for Medicare. But like I had mentioned, some individuals who have disabilities who are under 65 can also qualify for some of these Medicare Advantage or original Medicare plans.
All right, audience, how'd you do? No cheating. Here we go. Question number 2. True or false? You can enroll in a Medicare plan anytime you want. Audience, lock in your answer. Wait, somebody wants to phone a friend. They want to phone you. No, you can't call Dr. B. He's going to tell you right now. Is that true or false? Can you enroll in a Medicare plan anytime you want?
That one's false, and that's what I think confuses a lot of people. So there's actually an annual enrollment period where you can actually join a Medicare health plan, and that period is yearly. It's always from October 15th to December 7th. So that's when you can either choose a new plan or you can actually change your plan to another one. The exceptions to that, and there are a couple, is when you just turn 65, so if you have a birthday, you can actually enroll 3 months leading up to your birthday or 3 months after your birthday. And then for some individuals who may also have Medicaid benefits, they actually have some different enrollment times and can enroll multiple times throughout the year.
One quick question, not a true-false for me before we go to the break, and then we'll pick up the true-false game after. It's not like Social Security. You don't gain anything by waiting, do you?
No, not at all. Everyone should enroll in Medicare because it's a benefit that you're entitled to, and so no, you really should not wait on it. There's no advantage to waiting beyond your 65th birthday or when you're eligible.
All right, taking a break, going to come back, and I'll give the audience a little hint. Should I, Doctor, or not?
You can give them a little hint.
All right, a little hint. The question is this: Medicare doesn't cover some routine services. True or false? Lock in your answer whenever you feel ready or after you Google it. 821 Traffic Now, WWL. All right, 824, Tommy Tucker, WWL. PeoplesHealth.com. That's your one-stop resource for seniors and grown children of seniors to navigate your way through the choppy waters of healthcare, from doctors and medications to Medicare and Part D drug coverage. You can find everything you need to know or want to know at peopleshealth.com/radio. We spend some of Thursday morning with Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about senior health if you are a senior or the son or daughter of a senior. So before we went to break, gave the audience the true-false question. Medicare doesn't cover some routine services. The audience has had plenty of time. Doctor, what's the answer?
That's true, and there's a lot of confusion around that. But original Medicare only covers health problems, and so it really doesn't cover dental care. It doesn't cover vision care, over-the-counter items, or even prescription drug coverages. But those Medicare Advantage plans that I mentioned can actually bundle those services in under one plan that would be more like a traditional insurance plan.
And People's Health is a Medicare Advantage plan.
We are, that's correct.
Gotcha. Okay, so you can do all of that, jumble it one. What do you call it? Not jumble, but assemble. Put them all together. Question number 4. Yeah. Everybody pays the same for Medicare. True, false? Audience, lock in your answer. Dr. B.
Yeah, that's not correct. Everyone does have to pay a Medicare Part B premium, and that varies based on what your income level is. So it can be high or low depending on how much money you made in the past couple of years.
So I know you're not here to talk about Social Security, but if you get more with Social Security because you made more, then you're paying more for Medicare?
That's correct. So your premium, that monthly premium you pay on the Part B services, can be higher if you're getting a higher Social Security benefit, and usually it's actually deducted from your Social Security benefit.
Wow. Question number 5. There are only 2 parts of Medicare. True or false? Audience? Go ahead, doctor.
That one's false. And like I just mentioned, Part B, this is where it gets real confusing, but there are essentially 3 parts to Medicare. There's Part A, which is hospital insurance, which everybody gets for free. There's Part B, which is the medical insurance that you have to pay a premium for, that covers doctor's visits and outpatient visits. And then there's Part D, which covers prescription drugs. And then the final part, which they stuck in the middle, is Part C, which is the Medicare Advantage program, which actually usually includes Parts A, B, and D all rolled up together.
Question number 5. Number 6, rather. As it relates to the donut hole, and I'm throwing this one in, Dr. Fred, because I'm confused, rather. What is this hole they call the donut hole or something along those lines as it relates to prescription drugs or something?
Yeah, that's something that's within the Part D plan, and there's a lot of debate over how to change that over time. But what happens is the government, under a Part D, under a Part D plan, will actually pay for your drugs up to a certain dollar value, and then you hit a period of time where there's less coverage. So you may have to pay more for your drugs during that donut. And then on the back end of the donut, they actually start picking up the cost again. So what's important about that, and to talk with your doctor about, is the lower cost drugs that you can stay on, typically generic drugs that don't have as high a cost, will prevent you from getting into that donut, and then your cost for drugs over the course of the year will be less. A little confusing.
It is. And how can, like, somebody that, and look, when the time comes, hopefully I'll get there. I mean, that's a goal, right? You want to live long enough to get there. But if my kid would have any questions or something, or maybe just me, myself, how do you find out about all of this, about Medicare, Medicare Advantage? How do you even begin the process?
Well, one of the best places to go is the internet, like it is for a lot of things. But there's a wonderful website, Medicare.gov, which actually allows you to see all of the plans that are available in your area. They're all split up by the benefits that they offer, co-pays and deductibles, and what you may have to pay out of pocket, and all the different companies that offer those plans, and all of those Medicare Advantage plans are listed on there as well. You even have the ability, your kids can even plug in your medications that you're on, and it'll give you a rough idea of how much money you're going to end up paying on a monthly basis to make sure you've got the meds to take.
Put the kids to work. You've done enough for them. How can people find out more about People's Health, Doc?
So for us, probably the best place to go is peopleshealth.com/radio. There's a lot of information on there about all the plans that we've got and all of the various benefits that you can have with those plans.
And you can call 855-821-2666 and, of course, follow People's Health on Facebook, Twitter, or Instagram. Thank you, Doctor. I appreciate your time. Have a great weekend. We'll talk to you again next Thursday.